He was main organizing secretary at Gurgaon 2020. I was organizing secretary.
Thank you, sir. Good evening, good afternoon, all. Importance of medical documentation. The last few years, our society has changed a lot. Whether we have changed or not, or just forget our old teachings, that has to be seen. These days, mistrust in society for the doctors is increasing. Everybody knows about the isotine drops also. Mobocracy is the problem. Multinational healthcare has come into the play. And main thing is lack of communication or the poor communication. And then another factor which is upcoming is problem with the medical fraternity. The most important thing is poor record keeping. When we are, in trouble, we look into the records, and that is the important thing. Yellow journalism, when we are short of records, when we have to defend ourselves, journalism comes into the play. So that attitude of the society, which is towards the doctor, has to be changed, and we have to be very much, into the records. We are healers, will remain the same. But the thing is record keeping. Concept of family physician is changing. That days is gone. Yes, we have to be empathetic towards the patient, but we have to be very much into the up-to-date in records. And rather it has become a science itself. So importance is that comes into standard of care for the patient, for the institution, legal protection, for the doctor, and above all the ethical. Poor record means poor defense in the court of the law. No records means no defense, you are caught. Purpose of the proper records is patient care, communication with the patient, and further treatment. Days of TPA, so billing and reimbursement is of utmost importance. If records are not proper, claims will not be proper, patient will be, will not come to you back. And about research and quality management, that is the another thing. So legal documentation system relies on the documentary evidence in a situation if medical negligence is there. Medical documentation consists of all these things: electronic health records, physical examination, consent forms. Just now Dr. Deshpande has said. And these days, just now, even AIS has come into the consent forms in local, regional languages. When we are doing operative things, we have to put the time as well as, every person who is there into the OT. So safety starts with us only. All important documents, even investigations, discharge, instructions, discrepancy in the summary given to the patient in the hospital record, that always causes a suspicion. And that is, in the court of law, is tampering with the medical records. An undated prescription, if it is in the hand of the patient and it is goes into the legal system, if the prescription is undated, it can trouble, put the doctor into the trouble. Again, when we are doing referral, we have to put everything on the referral note. As by law, we have to keep the duplicate copy of the referral note with the patient's signature, that at this time I was advised to go, this time I was referred, and if something happens, wrong happens, only that document can save the doctor. We have to keep the confidentiality of the records also. These days, illegible handwriting is again, not taken in the court of law. As far as any kind of the surgery is concerned, if we are caught, we should have video recordings of our IOL surgeries and all that. Electronic health charts, ECG records, everything that has to be there. And that all helps in the patient management. So onus lies on the doctor, and who is at the pivotal role for the nurses, medical staffs and all that. So good medical record is which is accurate, accessible, comprehensive, consistent and timely updated. The issue of medical record keeping guidelines is maintain indoor records for 3 years, and if somebody asks for any kind of the copy or anything, that has to be supplied within 72 hours. Any kind of certificate, if issued, that has to be it should be duplicate copy should be there. So it is advisable to maintain outpatient records, even OPD records for 2 years, and for 3 years for indoor. And in pediatric cases like ROP cases and all that, we should have the records till the child attains the age of the maturity. And in death cases, records has to be kept permanent. And if the case is sub judice or in the medical record, that has to be kept till case is over. So by and large, medical records are the property of the hospital, and it is the responsibility of the hospital to maintain it properly. Records should be always in the safe custody. An unsigned record has no value. Failure to provide medical records to patient on proper demand is always a deficiency in service and negligence. Medical records, they are summoned in the court of law. These are various courts of law where the records can be required. And the policy for disposable is, once the time period is over as prescribed, indoor, outdoor and all that, they has to be disposed as per state policies, either by shredding or pulping, and the person who is destroying, who is helping it, that all has to be kept under documentation. So proper documentation both in the patient medical records and in claims is important to protect the doctor, to protect the institution and to protect your patient. Complete and accurate medical record keeping help you ensure that your patient gets the right thing at the right time and you are saved always. Remember, you have to be precise, you have to be up to date, and you have to be descriptive in your records, come what may. Thank you very much.